So you think you might need chin augmentation, but you're not quite sure. This may be a video for you. In this video, I'll be talking about ways you can determine if you have a weak chin and what you can do about it if so. Hi, I'm Dr. Sarah Saxon, double board certified facial plastic and reconstructive surgeon in Austin and Dallas, Texas. So if you have a weak chin, what can you do? Well, there's quite a few options going all the way from injectables to bone procedures. So injectables mean you can either do neuromodulators or fillers. Neuromodulators would be helpful if you have had a lot of tension in the muscle here. So things like Botox, Jeuveau, Dysport, they're really good to relax the muscle at the same time as you would do other options to give volume. For volume, injectables I tend to go for are biostimulatory fillers. So my go-to is Radiesse, which is calcium hydroxyapatite. That actually helps build collagen over time in the area. So when the gel surrounding the particles of the product eventually do dissolve, you're still left with more collagen and fullness than if you were to have a hyaluronic acid filler. There are some thicker, more cross-linked hyaluronic acid fillers on the market that you could use also. Allergan just came out with one called Volux, which is a little bit thicker one than their current products. I generally don't like the Vycross products from them because they can have some immunogenicity. You can also use a product from Galderma called Restylane Contour. So products like that that are a little bit thicker, you can use along the bone. It's not the same as if you're augmenting soft tissue in other parts of the face. You need something with a lot of strength to it. Now, if you have used injectables before and you know you like the result of a more augmented chin, the next best option for more longevity is a chin implant. And so there are some different materials that a chin implant can be made of. I generally use silicone implants. And the reason why that is if I ever for any reason need to remove it, it's very easy and I can remove it in the office. It has to be put in the operating room because I have to actually slide it in underneath some muscles. I usually like to do that through the mouth just because I can get a better, more natural contour that way. And if I've tried it in the office before and it just is too much. So too much tugging and pulling, too much pressure. It's just not the greatest option. If you insert a chin implant under the chin, technically you could do it in the office, but it's still a lot to handle to really lift that pocket and make it adequate to sit nice and flat. There are other materials for a chin implant. One is called MedPore. I don't like MedPore because it's meant to integrate into the tissues surrounding it so that it doesn't move around. But the problem with that is that it's textured, and if you ever have to remove it in the future, it can damage some of the tissue around it and it's very hard to remove. So in general, I like silicone implants to augment bony structures of the face. If a chin implant isn't something that sounds like it's something you want to do and you want to use your body's own tissue, you can do something called a sliding genioplasty. What that means is making a horizontal cut in the bone of the chin and sliding it forward. I have to keep it into position with some titanium plates and screws. Most of the time I have to contour the sides as well. It's a little bit more involved, a little bit more downtime, about a month of pretty significant chin swelling. You can have a higher risk of numbness because I have to work around the nerves here that give sensation to the chin. But for people who a chin implant just doesn't sound like a good idea to them, it's still a really great procedure. I do both of those and I really have to have the patient's input in which one is the best option for them. So if you have any questions about augmenting the chin, please let us know. You can email us at info@saxonmd.com. To follow along at any other procedures or future content, you can follow us at SaxonMD on Instagram or go to our website at saxonmd.com.